Alright, my name is Emma. I'm an undergrad at Tulane, and I did a study looking at the relationship between race and chronic inflammation. So we had 113 patients in total, 61 of them African American and 52 Caucasian. And then we looked at radical prostatectomy pathology reports and tried to, and we found 94 of the patients had chronic inflammation and 19 of them did not. From there I did a series of statistical tests looking at the relationship between race and chronic inflammation, and then also a number of clinical parameters. We did not find a relationship between race and chronic inflammation. However, there were differences in respect to the two races. From what we saw, the African Americans were more likely to have higher risk disease. For instance, African Americans had higher percentages of positive pores. They were more likely to have extraprostatic extension, higher PCA3 coffee levels, higher PCA3 scores than the Caucasian patients. And then in comparing the chronic inflammation categories, the patients without chronic inflammation were more likely to have positive margins, and they were more likely to have seminal vesicle invasion.
How are you?
And as you were mentioning, something that might have to do with these results with respect to the race, it might have been early detection. Early detection could have some play in the differences we saw. And obviously more studies will need to be done to look at this in depth with larger sample populations, and also defining the chronic inflammation categories more specifically, because in this one we just looked at the pathology reports, and so there was no specific, we didn't specifically define the chronic inflammation categories, so it would be better to do that in future studies.